Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today, the topic shall be septic and aseptic arthritis diagnosis. Arthritis is a very painful experience, and when you now find a situation where they are now describing two types of arthritis, septic and aseptic, you wonder that is arthritis different from one another? Yes, they are. And for the purpose of treatment, you must be able to differentiate and do the correct diagnosis. The effort I am making today, therefore, is to help us understand what aseptic arthritis is and what septic arthritis is, and how can we get treated, the best way for treatment, as well as what we can do to probably also prevent it. So if you like my video, press the like button, subscribe, and surely the support will go a long way in bringing more quality production. Yes, I had earlier stated the objective, but nevertheless, the objective is to create more awareness for the different type of arthritis, for more understanding and cooperation for effective treatment of the ailment. Now, the introduction. Arthritis is derived from the Greek term disease of the joints. It is defined as an acute or chronic joint inflammation that often coexists with pain and structural damages. We have different terms, a classification for arthritis. There is septic, acute, aseptic, and chronic aseptic arthritis. Another classification is acute, chronic, and reactive. And all these terms or classification I shall expatiate on. Let's look at the diagrammatic expression of the normal and the arthritis burn. We are looking at the nail, the normal nail. You will see the femur bone and the epilabia bone. The cartilage that covers the end of the bone is there, and there is also the synovial fluid in that space. But when you look to the right, you see arthritis bone. There is eating the bones, the cartilage has eaten up, and then you start having problem and pains. What eats up these cartilage could be bacteria. That's when it is called septic. It could even be virus or any of the microbial agent. So that is what is referred to as septic, which usually you take out the synovial fluid and examine for the organism that is affecting that area. But the ones that is aseptic, you don't see any bacteria or microbial agent there. What you see destroying are the defense mechanism of the body, the things that are supposed to protect. When you are talking of the chemokines that are usually produced, the T cells and all these B cells, all of them natural killers. Septic arthritis, that's one of the classifications. Septic arthritis is based on presence and replication of bacteria in the synovial fluid, with subsequent inflammation and joint destruction, potentially leading to sepsis and death if left untreated. Yes, it usually affects one nail. And when you are talking of the problem there, it is more of a polymorphonuclear proliferation. That is, the bacteria there are usually the pyogenic type. When you talk of Staphylococcus aureus, it produces so much pus. So the neutrophil, the white blood cells, and they will all come into that area in order to fight the microorganisms. And because the microorganism is also pyogenic, it produces so many neutrophil. So by the time you take it out and you look at the microscopy, you'll be able to really differentiate, and that's one of the very area that we shall talk on during the laboratory diagnosis. And it's differentiated too by affecting, it affects only one name, you see that redness, it's also showing. And these, because it's usually acute, it goes off after some time. It's not something that is going to be there for up to 4 to 6 weeks. Yes, the acute is septic arthritis. The term acute aseptic arthritis was introduced to capture the entity of acute arthritis without identifiable organism. Can't identify the bacteria or anything causing the inflammation. This comprises acute inflammation of the joint with identifiable non-infectious immunological etiology. You could suspect even viruses in this kind of situation because some viruses are not pathogenic, many. And you could also talk of these various T cells, B cells attacking. That is, you want to look at it because it is not producing any pulse. It is not likely to be Staph aureus or any of those pyogenic organisms. But the point is, you are seeing that there is inflammation. It is more of an inflammation not caused by infection. There is a kind of trauma there, and the trauma could be as a result of the attacking defense mechanisms when they attack that area, and usually it may subside, and that's why it's referred to as acute aseptic arthritis, because if it goes on for long, it becomes a chronic type, which is the aseptic arthritis. When we talk of aseptic arthritis, we are talking of now of the chronic arthritis, that is aseptic. Absence, what you notice, one is absence of any microbial agent associated in chronic inflammatory disease. And you can talk of rheumatoid arthritis, rheumatism, all these problems that makes that arthritis very painful, but you can never find what is the cause, except when you start looking at the defense mechanisms, all the chemokines, the interferons, the activated T cells, all of them are now attacking. That is, having auto antibodies produced against self. That is, it's usually a problem of old age, just like the impairment of all these defense mechanisms will not let them identify self very well again. And that is why majority of these chronic diseases are old age problem, because the defense mechanisms are really weakened and they are not performing efficiently anymore. You also identify this chronic disease with arthritis has been defined lasting at least 6 weeks. Then affecting other organs of the body, not only the nail or the heart. It could even cause serious endocarditis. When you find rheumatism affecting, you have to continue to give antibiotics. In this kind of situation, you are not thinking of antimicrobial resistance, because the patient has to be continually treated with antibiotics to safeguard. In spondylosis, there is also this ELA tells that you don't B27 is positive. We will see different deformity that these chronic diseases will cause, because it affects other organs of the body. The gradual shape from normal, the 3 different shapes you will see in the reactive is another classification, and the best way to understand it is to differentiate it from acute aseptic arthritis. So the acute one would really show the presence of the organism, but with the reactive, the organism had done the damage and it has left the scene, but the reaction is now being felt later on. So it's difficult to really find the organism, like
you want to really see to say yes, it is the cause, but it won't be there. The only way is now clinical examinations of that patient. You use the ocular involvement, that is, it probably conjunctivitis, psoriasis, and the previous information that the patient will give. So this is more of a clinical confirmation or examinations that would confirm, but to use the laboratory in probably doing some serological performance, it could be confusing because the person could have this antibody and still be healthy. So it may not necessarily say that that infection had been experienced earlier, except the laboratory diagnosis. Laboratory plays a very important role in differentiating some of these classifications. And the synovial fluid is also very useful to be able to say whether it is septic or aseptic. When it's septic, the WBC count will always be in this region of over 50 and 75. But if it's aseptic, it will be lower than that. Even the septic one could even go higher than the 50, as high as 100 or more. The septic joint, it could go higher. That is what I stated. The ESR, they are not specific tests. C-reactive protein is also not specific. The ELA test could be specific and could be used. Synovial fluid microscopic culture and sensitivity would always bring out if there is the organism, and the sensitivity will tell us the antibiotic of choice that will treat the patient and relieve the pain. Presence of serum anti-citrulinated protein is 95% specific, especially when you want to compare it with the ESR, the CRP, and other things you may want to do. The RH factor is also very important. The ASO anti-streptolysin titer. You could also use the X-ray to know the extent of the structural changes and whether the hope if the treatment is even giving better results, the ultrasound or MRI. Now, prevention and treatment. The prevention is very simple, avoiding the risk factor. Majority of our old age problems are due to weight problems, eating, and even a professor of immunology even recommended that if you want to prevent all these immunological problems, the autonomous reactions, the auto antibodies, where you have the autoimmunity problems at old age, the things that will really bring out this rheumatism, arthritis, rheumatic arthritis, and stuff like that. It's better to try as much as possible to just a little bit hungry, not always satisfying your hunger, but allowing that hunger to just be slightly there, especially not eating late at night could also be a very good help. The treatment is also as listed. A known anti-TNF therapy include these are more modern treatment, and it could be help in curing the problem.
Now that we know what septic and aseptic arthritis are, we can then look forward to correct treatment wherever we go for the right treatment. In any case, the diagnosis is very important, because if the diagnosis is wrong, ab initio, then you will just be having the experience for a very long time. And we must be careful that when this experience that is already chronic in its nature continues indefinitely, the pains and the stress, the effect on so many other organs of the body is immeasurable.